David Damsker, Audrey Kenny from our Emergency Management Department, and Larry King from Public Information. We appreciate your patience in waiting for us today. We've actually been really looking forward to having this press conference so that we can make sure we clarify what's happening with the vaccine. By the phone calls and emails that we're all getting, we know that everybody is pretty anxious and trying to figure out where those vaccines are. So I wanted to just start off with something that's really basic, and that's the supply of the vaccines. And this isn't in the county or in the state or in the federal government. I'm going to the actual Pfizer and Moderna where they're making the vaccines. You know, it wasn't like there were billions and billions of them made. They are just working on them. And from our understanding, as we've tried to understand the process, they can make millions a month, but there's over 300 million people in the United States. I understand that we're hearing from the Biden administration that we can expect it will take till the fall to get everybody in the country vaccinated. So from that perspective, it take that long to get everybody in Bucks County vaccinated. So it's difficult to wait. It's like it's the light at the end of the tunnel and you want to know when you'll be there, but you're going to have to just wait a little longer. We are doing everything we can. It's bipartisan. We have met with Republican and Democratic state representatives. We've talked to the congressmen. Everybody is actually working really hard together, but we can't get vials of vaccine that haven't been made yet. So we are working on it. We know it's going to increase. It increased this week from 2,000 to 3,000, and we think that's going to keep happening. So we will be moving along. If you think of the hand sanitizers issues that we were having last April, it's the same thing. You remember when you couldn't even find any, and you know people were getting desperate for hand sanitizer, and now it's on store shelves and they can't get rid of it. That's exactly the way this is going to go with the vaccine. So we do appreciate your patience, and I will hand this off to Commissioner Harvie for an opening statement, and then Commissioner DiGirolamo.
Sure, thank you, Commissioner Marseglia. Yeah, obviously, I was thinking about last year, almost this time last year, last March, late April, when the emails we were getting, the phone calls we were getting here at the county were all about COVID tests. Everyone wanted a COVID test. And where were they? Where were the sites? You know, what pharmacies were giving COVID tests, which test should we get? I want to get my mother a COVID test, my grandmother a COVID test, things like that. And it simply was that there were very, very few COVID tests available because this was obviously a new variant on a virus, and you didn't just have tests sitting on a shelf somewhere waiting for a COVID outbreak to occur. And it took time to manufacture, everything from the swabs to the little vials to the reagent, and then you had to roll it all out. And it did eventually, manufacturing caught up and testing became not so much of an issue. But there was a lot of anxiety and a lot of frustration, and we understood that. And the same process is happening now. And I want to let you know that this is not just a Bucks County issue, like Commissioner Marseglia said. We're in constant contact with the counties around us. In fact, we had a call yesterday with the Department of Health, the State Department of Health, with Montgomery County, Delaware County, Chester County, and us, all of us expressing the fact that we are not getting the amount of vaccine we need. Just yesterday, Montgomery County had to close their vaccination site because they ran out of vaccine. The county, Bucks County, has about 4.9% of the population of the state. We have vaccinated about 4.4% of the people in the Commonwealth of Pennsylvania. And it's also important to remember that people are being vaccinated whether they live or work in these different counties. So we have Bucks residents who are getting vaccinated in Monco because that's where they work, and Montgomery County residents getting vaccinated in Bucks, and we have people in Lehigh County who are coming here and people going to Lehigh. And so it is a very decentralized system that the state has started. That is something that we have asked them to really re-examine because not just we, meaning Bucks, but the counties here in southeastern PA have asked them to reevaluate how they are distributing vaccine because we do feel like we should be getting more, not just the county, but the hospitals here as well. So we are doing what we can. We're working with our state legislators, Republicans and Democrats, to make sure that our voices are being heard in Harrisburg, and that the Department of Health understands that we have a system in place. Monco has a system in place. Chester and Delaware County have systems in place and are ready to really step up and do what we can. But we're just waiting for that vaccine to come. And in many cases, the state doesn't have it. They rely on the federal government, and the federal government, as Commissioner Marseglia said, relies on the manufacturers. So I'll turn it over to Commissioner DiGirolamo for his opening statement.
Thank you. And, I've got the same message that you just heard from Commissioner Marseglia and Commissioner Harvie. I know it's easy to say we're asking everyone to be patient, but, that's what we're going to have to ask you. We are doing everything we possibly can, not only the commissioners, but all of the people here in Bucks County. We're doing everything we possibly can to make sure that we're ready when the vaccine starts to come in volume. We're ready to go to get people in Bucks County vaccinated in the 1A phase as quickly as possible. And again, we're going back, we're dependent on the state to get us the vaccine. The state is dependent on the federal government to get them the vaccine. And I don't know about everyone else, but I was kind of under the impression back in November and December when the vaccines were said they could come out, everybody could start getting tens and hundred millions of doses over the next few months. Well, that has not happened. And, it's taking time for them to manufacture the doses, and it's going to take time for the doses to get back to the state and then back to the county. But we are doing everything we can. We've hired a company to take over the sites when we do get the vaccine. And again, that's the 3 sites of the community college, one at the lower end, in the middle of the county, and the upper end. They're going to be the first sites that are going to administer the vaccine. I think that's going to start next week. And, as soon as we get a volume of doses, people will start getting calls, and we want to do this as quickly as possible. We're just going to have to ask for everyone's patience. And the part that we're working with the state and our federal legislatures and our state representatives and senators, I mean, that is absolutely true. And they have been a big help. And, we talked to the Department of Health this week, the State Department of Health, and let them know that we would like to get the vaccine as quickly as possible. So we're doing everything we can, and I'm just going to have to ask people to have a little bit more patience, and hopefully this will quickly break. And with that, I'll turn it back over to Larry. I guess we're going to take questions next.
I wanted to ask real quick before Larry asked that first question. As you said, Jean, we're going to be able to roll this kind of out to the more general public in 1A starting next week. And I wanted, Audrey, can you just give a brief rundown of what will be open next week? How will that work?
Sure. So we're going to have a distribution come out of our pre-registration site, the county's portal. It's been up for a few weeks now. We're going to work from that list to schedule 200 doses per day at the 3 community college locations. They will be from Tuesday through Saturday from 11 a.m. to 7 p.m. Everything will be registration based. It will not be walk-in appointments or drop-ins. It will definitely have to tie back to the registration portal.
Thank you. Okay, Larry, we're ready.
Okay, as you might imagine, we have a boatload of questions having to do with vaccines. So I'll start with a few from Marion Callahan of the Intelligencer. She asked about the vaccine clinic sites, and I think Audrey just handled that. But she adds, we know that at least 100,000 people and businesses in the 1A category have registered for the vaccination through the county. I know that the county's clinic at Wood Services is primarily vaccinated EMS workers and frontline healthcare workers. Of those registered in 1A, how many other people in the county's registration site have been vaccinated or gotten appointments?
Geez, I don't know if Audrey can give us that information. 200? I'm just trying to think of where we are with that.
On the number of people outside of 1A who've been?
No, number of people who are not emergency responders or some kind of healthcare provider.
Sure. Well, so from the registration portal alone, we have almost 200,000 people signed up on there. We've been trying to focus our energy to folks who fit into the 1A category. There's a piece with making sure that our first responders, inclusive of paramedics and EMTs, are being covered. And we are working to hit our most vulnerable population in the 1A category.
And I think if it helps at all, I think that we were able to open it up yesterday to sort of 1A, to like a couple hundred people maybe were able to come in so far.
Very few number of vaccines remained this week, but we've been trying to schedule our our senior population in the 85 plus range to get into some of our available slots at our remaining clinic this week.
So then Tuesday's the official day that we will be
Tuesday's
able
the
to
day
reach
that we're
out
gonna-
generally.
Correct.
Okay, also from Marion, we are hearing that educators with health risks who are in the 1A category are starting to get vaccinated. How did you arrive at this population to prioritize? Where are they getting vaccinated? And who will the next prioritized group of 1A recipients be?
I'll just quickly say, that prioritization had to do with those being special ed teachers who have to work with students who are unable to wear a mask, and those special ed teachers fell into 1A. Anybody else want to add to that?
Yeah, so, and they had to meet both of those requirements. They had to be teachers that fell into the 1A category, like you said, and they work with special needs students that are unable to wear proper masks or follow social distancing guidelines. And we thought that was a good, remember, the first week we were open, we wanted to make sure things are rolling along okay. And it was a schools are obviously very important to us to remain open. And we thought that was a good group of people to help get things kickstarted for AMI for the initial soft opening that we had this week.
Another question? Any other, Larry?
Okay, also for Marion, many people who have registered are looking for some clarity on when they will be vaccinated. We know the supply dictates when a timeline can be given. However, can you give people an idea of where they stand in this large segment of eligible population?
I guess I'll start, then I'll pass it off to Commissioner Harvie. I believe like within the 1A, we have 110,000 people that are registered. So we'll start rolling it out. I believe we're going to do 3,000. We're counting on receiving 3,000 shots for next week. We know that will grow, but you could kind of figure if you registered, say, January 20th versus registering yesterday, when you're going to fall within the calendar as we receive shots. Commissioner Harvie, do you want to clarify that any?
Yeah, we're going to do our best to, as we give out appointments to people based on when they registered, starting kind of with people who were there first, because you could argue that they waited the longest in terms of putting their name in, registering on our site. They were the first ones to go on there. We want to start with them and move our way through. We're going to be letting people know essentially, this week, we're going to do our best to make sure we're letting people know this week we're working on people who registered on this range of dates. So if you know roughly when you registered, you have an idea of where we are in the process as we go through. And I'll also add, one of the things we did before we came to this conclusion on this plan, settled on this plan, was we did take a look at just a random sample of 3,000 people who had registered, and took a look to make sure that it was a pretty wide variety of people. That it was people who, obviously they're all 1A, but it was people who were elderly, it was people who were maybe younger but have serious health issues. We also know that there are people who were registering through phone, don't have access to the internet. And so we are very conscious of making sure that we are reaching out to those people. And we have a system where we are going to be calling them, contacting them, and we'll be actually setting up appointments for them over the phone. And so that's something we want to make sure that we don't want to ignore the people who don't have access to a computer or don't know how to use a computer, and only serve the people who use a computer. We want to make sure we're mixing in people who also were calling us by phone.
Thanks, Commissioner. We know that the majority of the vaccine coming to Bucks County is going to entities other than the county health department, including hospitals and pharmacies and outpatient clinics. The question is, does the county have any say in how these operations distribute or prioritize their 1A population?
We wish we did. We would be very happy if we did. And we have DiGirolamo. I mean, you've had some experience with the state, so maybe you can speak a little to how frustrating it can be.
I know Dr. Damsker wants to jump in there, but and again, we don't have any say. And if I would encourage people that while they're waiting for the county to get up and running and get more doses in, I would encourage people to be proactive, not only with themselves, but with family members. And, contact your local hospital, see if they have a registration set up on their website. Call your local pharmacies in the area, see if they're going to be receiving any vaccine, and also check with your primary care doctor and see if they're affiliated with a hospital that they might be able to help you sign up. So I would be very proactive in trying to find how to get vaccinated, and that would be pharmacies, your healthcare provider, and your local hospital, and see if they have any vaccine available. Dr. Damsker, do you want to add to that?
Thanks, Commissioner. Yeah, I was just going to mention that, the hospitals and the pharmacies, they're all trying to do the same good thing. They're all trying to get the vaccine out the best way that facility can. So it's difficult to tell Grandview to do something the same exact way as Doylestown or St. Mary or Lower Bucks. They're all different entities with different abilities and capabilities and different numbers of doctors' practices. So, I think what's important is that we do speak to the hospitals a couple of times a week. So we kind of know what's going on, which is important. But we do leave it up to them to determine how they're going to roll out their vaccines. Because as I said, everyone sort of has different capabilities at this time. But everyone is sticking with 1A. I think that's a pretty common theme, obviously. And we're going to move forward together. But from a perspective of us telling people what to do, that's not the way it is right now.
Yeah, and just kind of building on the question that Larry just read, about 86% of the vaccine that has come into this county has gone to pharmacies or hospitals and not to the actual count, not to the Bucks County itself. The county health department has gotten about 14% of all the vaccine that's come in. And, there isn't any stockpiling here. We're using it. We're getting in the doses as they come through the week, and we're putting doses in arms. And we've done a pretty good job. We're above the state average in terms of how, just as a county overall, in terms of how much we're using that vaccine.
Yeah, I believe that Bucks County, the health department, are like 95% of the vaccines received. And I know that within the whole state, about 50% of the vaccines that have arrived in other counties have been given out, but in Bucks County, it's 80%. So we're really ahead of the curve on that. We just, again, need more vaccines to come in. Okay, Larry, another question? You're on.
Yes. Along those lines, are you aware of any penalties that are given to any pharmacies or doctors' offices that give people in other categories vaccines, essentially allowing some people to skip the line?
I'm not aware of that. Dr. Damsker, have you heard anything?
No, I have not heard of anything happening like that in Bucks County anyway.
Yeah, I mean, it's similar to masks, right? Where we didn't really have any enforcement. We are on our honor system a little here. Commissioner Harvie, could you?
Yeah, I can tell you because it came up yesterday in the county, the joint county call with the Department of Health. Montgomery County actually raised this issue because there was a pharmacy there, and I think that actually in Delaware County there was a pharmacy or a doctor's office where they seemed to be at least administering vaccine to people outside 1A. And the Department of Health said they were interested in learning about pharmacies who were doing that, because their goal is to give out vaccine sort of as widely dispersed as they can. And the idea being that the more places that have it, the more people have access to it, and it's more equitable. And that's fine. It makes sense. The problem is, of course, there's not enough vaccine to really go around. And so if they're giving vaccine to pharmacies with the goal of making sure it gets to the right people, if it's not getting to the right people, the Department of Health wants to know about that. Now, I'm not aware of it happening here in Bucks. We haven't received any reports of it happening in Bucks County, but I know some other counties have raised that concern.
Thank you, Commissioner. Not a vaccine question per se, but last one from Marion Callahan, and she wonders, how many cases of the UK variant have we confirmed in Bucks County, and how many additionals do you?
Yeah, we have right now. We obviously have one, and whenever you have one case of anything, you have multiple. And that's really important to remember about not just COVID, but with any disease. If you have one case of salmonella, there's always more. There's people that have had it that had minor disease that maybe never got tested or whatever. And there's also, of course, the idea that these variants, that even though they're from Britain, there's nothing stopping the variant from also developing in the United States also, right? It's the same virus. The mutations could happen anywhere in the United States. So we're a very large country. So there's lots of variants, I'm sure, in the United States that we're not even, aware of at this time. So I wouldn't take much stock if I say we had 1 variant or 12 variant or 15 variant. To me, the actual number is we may not ever know the actual number of the variants, just because, again, a lot of people are not going to get tested or don't feel bad enough to get tested. So, but as of right now, officially, the state is obviously, they're sending out a certain number of tests for identification of variants. They can't do every single one, but they're sending out a certain percentage to see what they can type. And I do anticipate that we'll have that variant here. We may have other variants, as time. I suspect we'll have lots of different variants as time goes on. But at this time, we're really treating them similarly. We're going to still put you on quarantine. We're still going to isolate you, very similarly to the normal COVID that's going around.
Thanks, Doctor. A few questions from Maggie Kent of 6ABC. She said, I read that 2 proposed sites, the Neshaminy Mall and Ben Salem Senior Center, would also be considered for max vaccination sites per Mayor DiGirolamo of Ben Salem. Can you comment on that, whether that is true or not?
We are looking at sites. We have some final agreements to arrange, but quite frankly, the sites that we are looking at have asked us not to disclose things yet. So, as soon as we get enough vaccines, we'll disclose and they'll be up and ready to go. Anybody else respond?
Okay, just a general question, I guess, for Dr. Damsker. What is the frustration that the health department is feeling? And beyond getting more doses, what can be done to help this process along?
I think that obviously the frustration there's a little bit of that because the state announced the expanded eligibility categories without having additional vaccine available. I think that was frustrating, not just for Bucks County, but that's sort of throughout the state. I've heard the same sentiment. No one got any additional vaccine in the weeks after that announcement. So I think it's frustrating for everyone. It's frustrating for us. It's frustrating for the citizens of Bucks County and elsewhere. What we can do is, and it sounds trite, but we are asking for patience really makes a difference. If people are angry about it, I understand. Obviously people are upset. They're afraid, and those are all very valid emotions to have. But as we've said multiple times on this call, we can only give the number of vaccine that we have. And as Commissioner Marseglia mentioned earlier, we're giving out as much as we can give out. Every week we get 3,000 doses. We're giving out that many doses in our clinics. And so really what I just hope people are patient. I think this is really, really important that we're going as fast as we can. If I can make more vaccine magically appear, I know they said if anything else other than that, but that's really what's going to solve the problem. And there will be a day, mark my words, that we'll have so much vaccine we won't be able to find anyone to give it to. Well, I know we're several months away from that, but there will be a time when there'll be enough vaccine for everyone who wants one, whenever they want one. And between then and now, it's going to be a gradient to get there. But we are working as quickly as we can. And I wish I had a magic bullet to give you, but I don't.
And the interesting thing is, some people have said, well, whose fault is this? I think we've tried to be pretty clear. It's no one's fault. We're not blaming anybody. Everybody is doing the best they can. When it comes down to supply and the manufacturing, we're all in hold. We're all waiting. It's no one's fault. This is just part of the process that we all have to go through.
Yeah, and just a thought, maybe I'm stating the obvious, but how much easier would this be if instead of needing 2 shots, you only needed 1 shot to get the immunity? And you need the 2 shots. And so when a person gets the first shot, we've got to make sure that we have that second shot available, whether it's 3 or 4 weeks from now. So that makes it that much more difficult needing the 2 shots than just needing the 1 shot. But it would certainly be a lot easier if we only needed 1 shot, but that's just not the case.
And that's actually the Johnson & Johnson shot that's coming out is 1 dose. And the other thing that makes it more difficult when we get to larger clinics also is that you have to wait 15 minutes after the vaccine also. We're really good at doing mass vaccine clinics. We can do many, many people. But the two things that Commissioner DiGirolamo just mentioned, the second dose, we have to take the time to schedule you for a second dose, which slows down the throughput. And then we also have to people wait 15 minutes instead of just walking out. So maybe hopefully they'll reduce that kind of requirement over time when they see that there's really no more additional anaphylaxis responses from the vaccine.
Ooh, you hit mute. Yeah. Dr. Damsker, you're on mute.
Sorry. Am I okay now?
Did you want to repeat it?
Oh, I'm not sure where I got cut off.
At the very beginning, but
Oh. Anyway.
well, if you
Sorry.
want to think about that, I'll just jump in here too and say, I know a lot of people might be saying, well, why aren't the commissioners fighting more? Even though it's no one's fault, why aren't they advocating? And I don't know if my colleagues can help me remember, but we have had meetings with the state reps, as I said, both parties. I know I've talked to the congressman and I know they're advocating. Commissioner Harvie is always on calls with the other counties and they're advocating, but again, you can't advocate for something that's not there. I'm trying to think of how many meetings we've had about this, Bob, trying to advocate.
Yeah, and and again, the frustration level, and I know that doesn't sort of, maybe it makes you feel a little better if you know that you're not the only one who's upset and anxious and frustrated. But it is across counties, and I talk with the leaders of the different counties, and I talk about the fact that we get criticized because people say, well, Bucks County is worse than all the counties around us, and the other county leaders, elected leaders, start to laugh because they say, well, it's funny because we get the same emails about how people in their county say that their county is doing awful and the county next to them is doing better. And a lot of people were talking about Lehigh County not too long ago, and Lehigh County got a lot of doses because they have an incredibly large healthcare network. And originally the original 1A category was healthcare workers. And so it makes sense if their number of hospital employees was double what Bucks County's hospital employee numbers were, they would have gotten more doses. And I called an executive in Lehigh County, an elected official, and talked to him a little bit. And he was talking about all the angry emails he gets from his residents because they can't get appointments. This is a frustration that is nationwide. And certainly true in the state as well. But as everyone said on here, I know how hard we're working, and I know how hard the counties around us are working, and I know that it's happening at all levels. It's just this is the largest vaccination program in human history, complicated by the issues of double dosing, complicated by the issues of the 15-minute wait time, complicated by the issues of you can't just store this. At least the Pfizer, you can't just store in a regular freezer. You have to pay special attention to how you ship it, how you store it, and how you start opening it. And so there are a number of complicating factors that make this incredibly difficult, not just from the numbers, in terms of how many people you have to vaccinate, but how you have to vaccinate them makes it even more complicated than that.
Larry?
Thanks, Commissioner. A few questions from Deanna Durante of NBC 10. Simple question. How many doses is the county asking the state for?
Well, we're asking for 640,000 twice, but it doesn't quite work like that. I'm going to let Dr. Damsker explain how he's allowed to ask for how many every time. And I'm not sure you have any idea exactly how they decide how many you're going to get, but.
Yeah, so what happened was we started our clinic at the Wood School for our for healthcare workers that I mentioned earlier, and we were able to get 2,000 doses a week the first couple of weeks, and then the state now you have to say to the state exactly how you're using it and how many are for first doses versus second doses. They don't just ship willy-nilly. And then we asked for additional doses and say, hey, we want to start public clinics now. And they told us that we were able to, basically they capped us out at 5,000 doses. So we've gotten for the first time this week between the Wood Services School and our soft opening clinics, we're hoping able to do close to 5,000 doses. But unfortunately, that seems to be the number that we're allowed to get for the next several weeks. We're hoping that will continue to go up over time, and each week we're going to need second doses. And is what happened to Monco, they didn't have enough doses for the second doses, but the state is very clear that they don't want you holding on to doses for the second doses. So we're going to keep asking for 5,000. We may ask for additional, as the need comes up for second doses. Let's say we have 1,500 to do for second doses. We'll ask for 6,500 and say, hey, we need 5,000 plus the 1,500 second doses. But the state is very clear in the ordering process. They want to know exactly what you're doing with it, who you're giving it to, which doses are first, which is our second. And we were told that 5,000 is the county max at this point.
And that's based on supply. So as they get
Correct.
more supply, they're going to change their numbers.
Yes, correct.
Okay, thanks. Do you have any idea, as of today, how many doses are available in the county between the hospitals, the doctors, and the pharmacies, as well as the county supply?
How many are where? Say it again, Larry.
How many doses are available in Bucks County today?
So I don't know how many, we wouldn't know how many the hospitals have. And I don't know how many, Audrey, do you know how many are left in the county today?
We have, I believe, 200 doses available that we're going to schedule out here in the next 2 to 3 days.
But we don't get a number for how many the hospitals still have on hand or how that is.
I don't have that information handy. I know that they share it weekly, but it is a much more generic number on what they have on hand. But they have done a great job with planning out their second doses too, to try to make sure they have enough to take care of their first and second doses for each week.
Thank you. We've seen some issues in surrounding counties involving link sharing of appointment links. How will the county head this off?
That's a tough one, right? We would very much like to have the ability to stop that. I'm not sure that we're working on it to try to get a block where that would not happen, but people should not do that. I mean, that's not really an ethical or respectable thing to do. And we would ask that citizens not share links. I don't know if anybody else wants to comment on that.
We've been working with our vendor to try to prevent some of that too. People are very technologically savvy and find ways to share that information pretty easily. And we'll do our best to mitigate it, but it is definitely a challenge that I think all of us are going to be dealing with as we try to meet the demand of these vaccination clinics.
And just to mention, depending on the clinic, you may share your link with someone who may be turned away at the clinic site.
Right.
So just be careful that you're putting someone potentially at the risk of driving somewhere, waiting in a line, and then being turned away.
Right.
So we would emphasize, especially as an elderly person, we're trying to, again, do whatever we can to avoid that. But we are asking people, if you're sent a special link to go to a clinic, please don't forward that. Even though we know you're doing the right thing, you have someone in your family that needs the vaccine. We understand that. But the clinics that we're sending, if people start showing up at clinics where they're not scheduled, it makes things very difficult. So please keep that in mind when you share something.
I'd add on to that too, because we have such a limited supply of vaccines available to us right now, it's really important that when we're planning out that we don't have any wasted doses at the end of the day. So we're really trying to strategically equip each of our vaccination clinics properly so they're ready to deal with the numbers of 200 a day is what we're looking at right now. That's not a lot to go around, but it's what we have to work with. So we're really asking people to be mindful of that before they share. We're going to be checking an ID against a confirmation to make sure that the right person is there for the appointment. And unfortunately, we don't want to have to do it, but we will have to turn people away if they're not registered.
Thank you, Audrey. I think you've got a crystal ball there, because the very next question was, are you going to be checking IDs at our clinics? And are you going to be restricting this to Bucks County residents only? The other question, and I think you just addressed it, was how many are we going to be able to vaccinate in one day, and how will the lack of supply govern this?
You can work or live in Bucks County, so I guess I can answer that. Did you want to take supply, Doc?
Yeah, so we want to do, as Audrey mentions, 200 per day per clinic starting next week. So we'll be able to do 600 per day over 5 days is 3,000 doses. And then we anticipate moving that up to 4,000 once the Wood School, we're closing that campus down next week. So we're hoping next week to get 4,000 doses, and then 5,000 after that when the Wood School is completely shut down. So that'll move us up to 500 per day per site, 1,500 per day or so, maybe a little bit less. And then over time, heard somewhere that now they got 5% of an increase or something like that. The state will be getting a 5% increase from the feds at some point soon. I heard that this morning. So that would give us an extra, 250, 500 doses, and then slowly we'll work our way up so that each site is very busy every day. And then, as Commissioner Marseglia said earlier, once we get to a point where we have enough doses to open up a 4th or a 5th or a 6th site, and we're excited to have to do that. We want to be able to get enough doses to open those sites in the meantime. But yeah, that's what we're looking at, around 3,000 a week, then 4,000 a week, and then 5,000 a week at least. And again, some of those end up maybe being a little bit less because we'll have to start doing second doses mixed in if we don't get more than 5,000. So that's kind of where we are with supply.
Okay. Looking a little bit ahead, is there any thought that's been given when the Johnson & Johnson vaccine is released of giving that to less vulnerable populations and saving the Moderna and Pfizer vaccines for the more at-risk people?
Yeah, I was gonna say anywhere we can go to do a one-off, like if we're taking, for instance, if we're using a strike team, it's called, somewhere where we go out to a facility or to somewhere where it takes a lot of effort to go out there, that would be a great location for a 1-dose Johnson & Johnson. So that's such that a month later, we don't have to go back and do the same site again. I think it's a great idea for homeless shelters where you may not be able to really do a good job scheduling them out for a month. You may not know where they're going to be or get a hold of them. So I think there's definitely some places that we can go to. Again, if we have to go out to them and we're doing it, an on-site type of a reach out type clinic, then that's the kind of clinic that'd be perfect to do once. We don't want to have to go back twice to some of those sites. And I think anyone should be thrilled to get, even if Johnson & Johnson, you may hear, okay, Johnson & Johnson 75% effective, but the Pfizer's 95% effective. What's important to note about Johnson & Johnson so far is it prevented all severe illnesses and deaths, right? And that's what we're really trying to prevent. If you get Johnson & Johnson and you end up getting a breakthrough runny nose or whatever the situation is, that's okay, right? I mean, no vaccine works 100% of the time in everybody. And you may have heard that there was a case in California, I think the other day, where someone had gotten the vaccine and a couple of weeks later he got sick because his girlfriend had it. I don't know all the details to that because I'm not privy to it. But what I can say that is, yes, there will end up being no vaccine is 100%. We have people who get mumps every year. We have people that have pertussis. We have people that get measles that were vaccinated, right? So no vaccine is 100% effective. But I can tell you that the real important point is that these vaccines seem to be preventing deaths and serious illnesses and hospitalizations. And in the end, that's really what we want anyway. We're never going to stop the common cold. And if people end up getting, minor symptoms or maybe even minor flu-like symptoms after they've been vaccinated, then that's a huge victory, right? We're trying to keep our people out of the hospital and keeping them from dying, which is really the point. We're never going to eliminate COVID. I don't think that's going to happen anytime soon. So if you get the Johnson & Johnson for the 1 dose, be thrilled with that. If you get the Pfizer, be thrilled with that. Anything we can get it to people, we should be happy to give.
Thanks, Doc. And looking even farther down the road, do we know yet how long people who are actually vaccinated this week, some of whom are probably going to wait months to get vaccinated, will need to turn around in another year and get vaccinated again?
Yeah, and the CDC just put out guidance, I think this morning. Someone showed me something really quickly that, as of today, if you get infected with COVID, you have 90 days where you don't have to quarantine, you don't have to, you're basically clear from COVID for 90 days. The CDC came out with guidance today that said that once you're vaccinated, they're trying to match that up with the infected people. So once you've gotten your second dose, they give you 90 days so you don't have to quarantine again. I was kind of hoping they would extend it longer, and we in Bucks County might extend that a little bit longer here as well to 180 days, because it makes it's kind of a, I don't know if that's a great precedent to set that say that it's only giving you 90 days protection, because then, that means 90 days from now, you have to get a booster, right? So I think that there's still a lot of data that has to be done and looked at and to move forward. But I do anticipate that as COVID changes, like flu does, that there will probably be boosters made that have slightly different tweaks to it that will account for some of these variants that'll pop up. And if COVID is anything like the flu, which it is in some ways, from a mutation perspective, it's going to keep mutating and keep making changes. And they're going to have to target maybe different proteins on the virus and look for different ways for it to work. So I do anticipate having to get booster shots for this. Hopefully, I think the Moderna, they're looking at evidence saying maybe not for 1 to 2 years, but that. But yeah, I anticipate everyone getting a vaccine will probably need a booster at some point. No one can say whether it's going to be in a year or 2 years. They can't say it just yet, but I would anticipate we're going to have to do that. The nice thing is, once vaccine supply is ramped up, it'll kind of be like what flu is. Right? You can go to any pharmacy, most doctors' offices, supermarkets, and you can get a flu shot pretty much whenever you want to. And I think once the vaccine is rolled out to that point, it won't be as big a deal as it is today, because anyone who wants to get the COVID booster can go at their time of choosing to whatever pharmacy or doctor's office they want to go to. Obviously, we're still a little ways away from that, but I do anticipate that's the way it'll be on an ongoing basis. So yes, we may have to get a booster, but we won't have to go through the whole process that we're currently doing now. It'll be much easier to get.
Okay, thank you, Doc. Some questions from Hank Flynn of Fox 29 regarding Genesis Diagnostics in Middletown. He was wondering what is Bucks County's relationship with Genesis Diagnostics, and do we know why they were raided by federal investigators last month, and what was in the containers that the investigators took away?
No idea. Anybody else?
I can just tell you that we have sent county employees there. We have sent first responders there for testing. Genesis has a lab on site, and they do the tests. They do PCR testing very quickly, and that's our only relationship with them. I believe the jail may have been using them for testing, because again, the lab is in Bucks County, and they were getting turnaround times very quickly.
Doc, but you referred them there without a contract. They went there.
Correct. Yeah, we have no contract with Genesis. That's correct. It was the same as sending them to CVS or to an urgent care.
Also from Hank, and I think we've addressed this at least partially. He says something like 10% of the doses Bucks County obtains go to its mass vaccination sites. I think we're talking more like 14% of the county's doses go to the county health department. And he says, correct me if I'm wrong, but is 90% going to hospitals? How are lower income and less privileged people to access vaccinations in Bucks County? I know 90% is not going to the hospitals, but if you have a sense of that, he's wondering.
I think the first thing I'll answer on this one is that we have no say over what goes to the hospitals. And I know a lot of people think that the state is sending us all the vaccine and then we disperse it to pharmacies and hospitals, but that's not how it works. We only get our 14%. The state is, and I don't know how they decide it, they decide how much each hospital is going to get and how much few pharmacies are going to get. Commissioner Harvie, do you want to continue to respond to that?
Yeah, well, Dr. Damsker referenced strike teams earlier, and that's one of the things that we are working on developing. Again, once we have enough vaccine, we can be able to sort of put these teams together of our people who will go out to different locations and make sure that we're hitting areas of the county that may not be getting hit with the other 3 clinics that we're going to be setting up. But having clinics set up in the upper, middle, and lower ends of the county was something obviously intentional. We want to make sure that we're distributing the vaccine as widely as we can. We're also going to be working on rolling out information in different languages, working on a video right now that's going to go out, working on flyers that we're going to be giving out to different community groups in different languages, emphasizing the importance of getting vaccinated, because we do know that this virus is hitting communities of color and communities where English isn't always the first language, hitting them especially hard, and we want to make sure that we're addressing them as well.
Thank you. A few questions from Frida Savannah. I think a couple of them have been answered already, but she's wondering who will be staffing the clinics that the county is opening at the community college campuses?
So we have a contract with AMI, and I'm thinking that Audrey might want to talk a little bit about that.
We've done a turnkey solution with AMI to provide us with everything from registration desk help all the way back through the clinical support, the people who are applying the vaccines and then monitoring the patients after they've received it for the 15-minute window. It is a full solution. We have augmented just some supervisory personnel from within emergency management, and also Dr. Damsker's team has provided some of their expertise from their clinical work at the Wood Services site. So we've been just getting them up and running and making sure everything's going okay. And we're not have on hand initially, but they are expected to provide all supplies and support staff.
This is a big effort, so it's really important, no matter who did this, whether it was a hospital or us, other staff is going to have to be brought on. You can't easily vaccinate 600 and some thousand people, you know, with just the hospital or county staff right now. Anybody else? Commissioner Harvie or DiGirolamo?
No.
Also from Frida, she's wondering what is the total number of Bucks residents needing vaccinations, and how many, both in terms of number and percentage wise, remain to be vaccinated. I think I can speak to what the state says on that we have 34,700 people who have been partially vaccinated, who have received the first dose. And we have a little less than 13,000 people who have been fully vaccinated. And this does not include the people in our long-term care facilities that are being vaccinated by pharmacies. That's a completely different record-keeping system. But if there are some others that you wanted to speak to, I'll turn it back over.
Well, the one thing too to remember is, you know, we keep using this number. We have about 630,000 people here in Bucks County, but you know, neither of these vaccines is being administered to kids under 16. So, you know, I don't think we know what percentage of our population that is, how many, you know, kids between 0 and 16 there are in Bucks County, but you're subtracting that from that 630,000 number. And reminding people again that you do have people from Bucks who might work in a different county and have gotten their vaccine. You know, they might work at Abington Hospital, or they could work at a long-term care facility in Lehigh County or Hampton County. And so they've already gotten vaccinated. And we wouldn't necessarily know that because they would count as a vaccinated person in that county, not necessarily in our county. So it's not quite as simple as just doing, you know, the kind of simple math.
Thank you. A couple of questions from Jackie Ferris of Channel 69. First, can you talk about Dr. Fauci saying that people need to double mask?
I think it's a great idea. I mean, what I understand is they've done some studies and they've shown how much air is coming out if the mask is kind of loose. So by putting on 2, you're extra protected. Dr. Damsker, and then anybody else who wants to jump in on the double masking.
Yeah, I mean, I would say that anyone who wants to wear 2 masks is I would never say don't do it. You know, what masking, the most important part of masking, honestly, is that those that are ill wearing a mask, and we've talked about this, you know, for many months, is that if you have COVID, you're not going to be spreading it anywhere near as easily if you're wearing a mask. And yes, wearing 2 masks is the studies show that it may be better, but you know, wearing an N95 mask is really well, but those are uncomfortable to wear. I suspect that wearing 2 masks over time may grow uncomfortable as well. I just think what's important is that we're wearing masks, and that if you're sick, don't leave your house. If you have to leave your house, even if you think it's asthma or allergies, those are the people that have to be wearing their masks. I know it's those are the people where masks, I think, are most helpful, are those that are sick. Now, not everyone knows that they're sick, and that's why we have everyone wear masks, because you could get sick the next day. But you know, saying we can wear 2 masks, you know, it's equivalent to saying N95s work better than surgical masks because you know, it's an additional thing that you're wearing. I would just recommend that if nothing else, people wear masks, and I think that we've done a really good job with that. But I wouldn't stop anyone from wearing anything that they feel, you know, makes them healthier.
Yep. And just, if I could just add, and we're talking about getting vaccinated, and even after people are vaccinated, whether it's the first dose or getting 2 doses, it is still highly recommended that they continue to wear masks, even though they have the protection of being vaccinated. It is critically important that you continue to wear masks as well after you get vaccinated.
Thank you, Commissioner. Also from Jackie Ferris of Channel 69, we are hearing reports from the CDC that people who are fully vaccinated and are exposed to COVID, that they do not need to quarantine. Can you talk about that, especially in light of reports of the California man and others who were fully vaccinated and later were diagnosed with COVID?
Saw that in the
Yeah,
news this morning, Dr. Damsker?
Yeah, I think I mentioned that earlier, but yeah, right now the CDC is recommending that once you've been fully vaccinated, that you don't have to quarantine for a period of 90 days, which is the same as if you've had COVID, you have a period of 90 days where you're considered to be immune. Push that out to 180 days. I think it's really important that they do that. To be honest, I would prefer that we do that here in Bucks County. You know, again, no vaccine is 100%. If we're giving it to, you know, I think there's been what, 30 million people that have been vaccinated in the United States, something along those lines. Any vaccine, even if it has a 99.9% efficacy rate, 0.1% of 30 million is still, you know, whether there's 30,000 or whatever the number is, it's still a lot of people. So, but that's not a reason to doubt vaccination. And that's certainly not a reason why over time, the vaccine is our way out of this, because even if we have some COVID breakthroughs of vaccine, so what, right? The vaccine is our best, again, is our best route to get out of this, because I don't think anyone on the call or watching this call wants to be wearing a mask 5 years from now. So the real answer is let's get the vaccine out, let's get it into people, lower the number of cases so that they're rare. And I think that's the pathway we have to take. And we shouldn't worry so much about a few cases breaking through the vaccine, because that's the case with any vaccine that we have.
Thank you. A few questions from Tom Sofield of Levittown Now. He asked the $1 million question: how long does the county expect it to take to vaccinate all Bucks Countyans who wish to be inoculated?
I would say we keep trying to figure that out every day, doing division, trying things. You know, I understand that President Biden has said it will take till the fall. So if it takes till the fall for the rest of the country, I guess that's the same thing with us. Dr. Damsker, anybody else have a guess on that?
I think if the faster they can get the AstraZeneca and the Johnson & Johnson on the market and ramp up, if we have having 4 vaccines available is a lot better than having 2. And I think it really is important that, and they're ramping up. As I said, I think it was Sanofi that's going to start making Pfizer. I think it was. It may not have been this country, but somewhere else. I'm surprised that they haven't sort of given the formula to other manufacturing companies. You know, why does you know Johnson & Johnson have to be the only one making Johnson & Johnson? Like, you would think that they would give the formula to other manufacturing companies to increase. And I believe the first I had heard of that was Sanofi. They would be making the Pfizer product. I believe that's what it was. And I'm hoping that that kind of thing gets done more and more frequently. But again, having 4 companies, even just 4 companies manufacturing and having a wide selection, and they're all going to be ramping up, you know, 5 million here, 10 million here, 20 million here. You know, we're really hoping that, yeah, by the summertime, we'll have enough that, because remember, there's 630,000 people in Bucks County, but as Commissioner Harvie said, the kids aren't even eligible yet under 16. So that reduces that number. And then as well as the fact that there's a certain percentage of people who just don't want to get the vaccine. They don't trust, you know, the procedure or whatever the situation, they have a health condition, whatever the situation is. So we don't have to do potentially 630,000 people. So I'm hoping we can get to the point where there's enough vaccine for the people that want it by the summertime.
That's an even better number. I like that.
Tom's next question is, if Bucks County does not have enough doses by the time its vaccination clinic contract with AMI runs out in early April, will there be a refund?
I think we aren't even charged. Audrey, did you want to talk to that one?
They're charging us on the services that they provide for the materials that they've procured to run the clinic. So those types of commodities that they're using to basically keep the people who are working there safe and to have a safe environment for people come to. Those pieces and parts are in the contract. We have a 3-month extension if we need it, and so we've tried to pre-plan some of those things. It is definitely a not to exceed contract, and they're only billing for the services that they provide.
And the not to exceed means it's like a hard stop. So if they ever spent up to 14 million, they'd have to come back to us, but it's possible we won't go anywhere near that. And this is all money that came from the CARES Act, correct? Or from the federal government?
Yes, and again, that's very important. What you said, that Audrey said as well, is that it's a, if we only have let's say for the next 3 months, we only have the 3 clinics open. We're not going to approach $14 million at all, because the $14 million includes multiple sites in addition to the 3 and potential strike teams. So that $14 million is assuming that everything was up and running for the entire 3 months. And clearly we're already in the contract and we don't have everything up and running. So it's not going to approach $14 million. And it's very important that they are charging us, per the time and materials spent as we go along. So we have not given them $14 million. It's not like that.
Thank you. Tom has some questions also about our testing clinics that we ran. He's wondering, why did the county begin a testing clinic nearly a year after the pandemic began, if residents had been asking about free testing for months prior? And how many patients were served by that clinic?
I'm just going to go first and say the testing is a great example, as Commissioner Harvie said earlier, of what's happening now with the vaccines. We couldn't get tests in the beginning. That was the tough part. Of course, as the tests became more available, we were able to get them for those clinics. But Dr. Damsker, I don't know if you want to do the other part of the question.
Yeah, just, you mentioned free testing. Like, testing has been free for the most part the entire time. Like, it's covered under insurance. And if you were to get an insurance, if you didn't have insurance, they were supposed to be able to bill the state through a federal program where you shouldn't have been charged. I'm not saying that always happens. Sometimes the urgent care may charge you a fee to see the provider before you get tested. But a lot of times it came down to early on, we didn't have, even though there was a desire for people to get tested early on, we didn't have we couldn't have just contracted with someone to do testing at that point. It wasn't available. And then over time, the testing became more widely available. There's plenty of places people could go. And to be honest, it didn't really become a problem until the recent surge that we saw, after Thanksgiving in December. People were traveling, the new travel thing came in, people had to try to go get tested. And that's when we started seeing some lines. And at that point, in December, we started talking about, now's the time that we could provide something for the residents. It took a couple of weeks to get set up. Obviously, you can't just run that from the second you think about it. But it was successful. I know there were several thousand people done, maybe close to 4,000. I don't know the exact number. We can maybe get that for you.
We conducted 3,400 tests.
3,400 tests. Okay. And again, that was done. It was helpful. I think people were appreciative. They got in and out very quickly. And now, because the cases are dropping, and I want to make sure that's said on this call today, is that our cases are dropping. More importantly, our hospitalizations are down to under a dozen. And that's where we were, for much of the summer and the fall prior to that surge. So from a hospital perspective, we're almost back down to the baseline cases we had. We're still, if we have 100 people in the hospital, 10 people on ventilators. Obviously, that 100 includes people that are there for pancreatitis. That includes people who are there for broken leg that happen to test positive when they bring them in, because they test everyone that come in. But the overall COVID numbers are much, much better now than they were back or that started around Halloween. I think that's really good news. The numbers of overall cases are still a little bit higher than they were this summer. But again, the virus is in the community, so it's going to be tough to get it back down to 5 or 10 cases a day. But we do, hopefully, as people get vaccinated, that those numbers will come down again. But I want to mention that before we get on this call today, that the numbers are looking really good. And that's not just here in Bucks County. That's across the state, across the country. You should look at some of the graphs out there. The death rate is dropping down off a cliff. The numbers of cases are dropping down. And that's in most states that I've looked at. So, again, we have less than a dozen people on ventilators. We have approximately 100 or less people in hospitals all across the county of all residents. The numbers are looking much, much better. And so, as we've said multiple times, let's keep doing what we're doing, and let's be smart. And as we ramp up the vaccines, it's a very nice confluence of cases going down and vaccines going up. And that's sort of the combination that we're all looking for, to put this in the rearview mirror at some point.
Now, I'll also add in that we knew from working with AMI, kind of early on, talking with them, that we had a plan for a vision for creating vaccination sites. And so bringing them in to do the testing after what we expected would be a big surge of cases around the holidays, having that testing available for people, as Dr. Damsker said, we're starting to see lines in places, but also knowing that having AMI come in and do those testing sites would allow them to more seamlessly move right into doing vaccination sites, because we were confident they could do that as well. So it really was a vision for something more than just testing sites.
Okay. Thank you, Commissioner. That ends my list of questions, so I'll turn it back over to you for any closing remarks.
Commissioner DiGirolamo, any closing remarks? You're on mute. Sorry.
Sorry, just want to let everybody know we're doing everything we possibly can to try to get the vaccine here in Bucks County, and everybody's working together. The 3 commissioners, we're getting along very well, working together, and all the different departments that are involved in the vaccine and the vaccination, we're all working together. It's 7 days a week. We have meetings and calls at night, and we're up here every day. We're trying to do everything we possibly can to make sure that we get everybody in Bucks County that wants a vaccination as quickly as possible. Thank you.
Commissioner Harvie?
Yeah, I would just echo Commissioner DiGirolamo's point. We are, again, moving through this very uncharted territory with everything that's going on. The communication we've had with the counties around us has really been very, very helpful. We're all just sort of feeding off each other in terms of the ideas and plans. It is really important. A few things, again, we're going to be working off that list of people who are registered through our site. I think Audrey's going to mention something a little bit about what to expect when you get an email. It is important, as Dr. Damsker said, you get that link to create, your appointment. Do not forward it to someone else, even though you really want to, and you think maybe somebody should get up ahead of you. We're doing it just the fairest way we thought was just based whoever registered first, that's who we're going to go to. But we are going to keep an eye on who's getting those appointments to make sure that we are keeping it balanced in terms of people by age or by medical condition and things of that nature. We want to make sure that we are hitting everybody we can. We're going to be working with as many partners as we can. We've had very good relationships with the hospitals for the whole year in terms of who they're working with. We certainly would have preferred, not the sort of shotgun approach to this that the state has implemented, and we've asked them, along with our neighbors and our state legislators, to really kind of reconsider how they do that, because we know it's frustrating for not knowing who's getting it, and you're on a bunch of different lists, and you're waking up at 4 in to see who you can get on. And on sports radio this morning, they were telling people to go on the CVS page and say you live in New Jersey and get your shot there. And I think it's going to take a very brief amount of time for New Jersey to figure out that they want to try maybe to shut that down, because there could be a lot of New Jersey residents who can't get appointments because Pennsylvania people are getting them. So everyone is in this together. Everyone's trying to pull the oars in the same direction. We're just, again, asking for patience, and and if you want to communicate with your state representative that you want them to sort of ask Harrisburg to reconsider how they're doing it, that's certainly, we're doing that. So it's certainly something you're able to do as well.
Audrey, did you want to say something about InfoTrack?
Right, so this week was the first week we've been using our new solution called Track My Vaccines. And so when folks get an invitation, it will come from info@trackmysolutions.us. We have put a lot of time into trying to tweak some of the fields that are in there, but it is definitely an invitation to attend one of our clinics. So I just wanted to make sure folks knew that.
Okay, and just a couple things I wanted to add that I was thinking about. One is just on AMI. I know there have been questions about how we selected AMI before, and that was a highly vetted process. The state uses AMI and they came highly recommended. So that was how we got them. You know, we made sure we were getting the best we could for the county of Bucks. And I'm again asking for your patience as we wait for supply. I know many of us are watching the news, especially the cable news networks. And if you watch them, a lot of times it looks like everybody else in every other state is getting a vaccine. And it seems like the grass is greener everywhere else. But that's because they're just doing a story then about the people who are getting the vaccine. We are all struggling because of the supply issue. So just be patient, be kind to one another, and we are working on it. Dr. Damsker has a lot of hope that we're going to be there by the summer, and we appreciate your time today. So thank you.